Hi there, Dr. Davin Lim, board certified laser dermatologist. Today we are talking about 5 tips as to how to make your Accutane treatment that much easier. I'm having actually help from a couple of colleagues, so it's not just me, but we'll get some real pearls from a few of my colleagues who will give you their tips for their patients. So listen carefully and this will make your life a lot easier on Accutane. Okay, tip number 1, slow and steady. It is not a race. I often start patients low on 10 milligrams. Remember, look at the progress over the next 6 months. It's slow and steady, but you will get there. Roaccutane or Accutane treatment is not a sprint, it is a marathon. Start slow and work your way up. Now the next tip comes from Queensland's most experienced dermatologist. So we've got Dr. Belle Comenos here. Hi Belle.
Hi Devin.
Okay, now what's your number 1 tip for patients on Accutane or isotretinoin?
Don't forget your lip balm. Use it at least 3 times a day and especially at bedtime.
Excellent, that's my tip as well. So you've got it, you beat me to it, Belle. Thanks for that. Cheers. Tip number 3 comes from Dr. Tanya Z, who has got an amazing shoe collection. We've got Dr. Zappala here. Hi Tanya.
Hi, Devin.
Okay, cool. Okay, what is your tip? We're just after 1 tip on patients who are on Accutane or isotretinoin. What's your tip?
The main side effect, as you know, is dryness and sun sensitivity, and I often tell patients that if they're going to the beach on the weekend or they're going skiing on the weekend, to not suffer through, just stop their Accutane 2 days before and they'll have much less dry lips, much less sunburn, and they just start again Sunday night. There's no problems with starting and stopping it to titrate to a side effect.
Hey, freaking awesome. That is a really good tip. Thanks, Tanya. Thanks all. Thanks, Dr. Zappala. Thank you. So tip number 4 comes from board certified dermatologist, Dr. Paul Ting. Hey Paul, how's it going?
Yeah, good, thanks.
Good, good. Hey, what's your number 1 tip for patients on Accutane? Number 1 tip.
All right. For sunscreens, the most important thing is to go oil-free. So even though they're on Accutane, their skin is dry, they've still got a tendency for blocked up oil glands. You must keep with oil-free sunscreen. Still high SPF, as you know, Accutane increases your photosensitivity, at least 50 plus SPF.
Cool. Anything else? What about the ears and neck? Do you ask them to apply them to the ears and neck as well?
Absolutely. Cover all of the sun-exposed sites, including the face, ears, neck, all the creases behind the ears there.
Cool. Mate, hey, that's a great tip. Thanks for that, Paul.
Cheers. All right.
Hey, now it's the final tip. It's controversial and it comes from me. Guys, here's my tip. Look, all the other dermatologists beat me to it, but this is my tip. It's called lifestyle. Everyone has their own lifestyle when they're on Accutane. Now, modify your dose in accordance to your lifestyle. So, hey, you didn't hear it from me, but it's this. The product information says don't drink, but if you are sensible with this medication, if you're going to take 2 or 3 drinks 2 or 3 nights a week and be on a very low dose, go for it. Once again, you didn't hear it from me, but that's a sensible option. Certainly, if you're going to have a binge or you're going to drink a lot of alcohol, make sure you go off this medication. And like Dr. Z said, if you're out in the sun and going for a holiday, drop down the dose. Lifestyle, that's what it's all about. And look, extending my tips further, a couple of other things. First of all, drink lots of water, stay hydrated. Most importantly, it doesn't mean if you're on Accutane, that's it. You can do lots of other things to help your acne. First of all, develop a good skincare regime. Secondly, diet, super important. You know that foods such as sugar foods, chocolate, sweets, all those high GI foods flare up your acne. Get off them, yeah? And also lactose. It's been shown that milk or dairy products can actually make acne worse. So if you're drinking lots of dairy, cut it down. So all of these tips will help you gain your knowledge to actually make your treatment a lot easier and the results will be great. So look, the results are there. Be patient and you can see that Accutane is a good treatment for the majority of patients who have really severe acne or acne which just doesn't go with normal treatment. So be patient and you'll get there. So guys, Once again, thanks for watching this video. Thanks to all my colleagues for actually contributing to their own pearls and their own tips in regards to Accutane. It's not just my effort. Remember, these guys have been practicing, in fact, Belle's been practicing dermatology for over 25 years. So look, we've got in all like maybe 60 years worth of experience. These are just 5 of our tips. Certainly your dermatologist will have their own tips in regards to Accutane treatment. But if you keep things sensible, you'll just breeze straight through it and it's just going to be fine. Once again, thanks for watching this video. And remember to subscribe for more information, and I'll keep you up to date with anything dermatology wise and give you little tips and hints throughout the way. Thanks again, viewers, and all the supporters out there. Cheers. Bye.